Hi everybody, my name is Diana and I am a nursing student at the Avalon Christian University School of Nursing. Today we are going to be discussing the cardiovascular system as it pertains to aging. Before we begin, to give you an idea of how this presentation is going to flow, I have listed the major questions we are going to be answering. We're going to talk about changes that occur in the cardiovascular system as we age. We're also going to talk about how some assessment findings may be different based on if our patient is older or not. And we're also going to talk about cardiovascular diseases common in the geriatric population and important education points that our geriatric patients and their families/caregivers need to know about. So, first things first, what changes do occur in the cardiovascular system as we get old? Now, there is typically a functional decline in the cardiovascular system, and this can be attributed to the structural and electrical changes that are occurring at this stage in life. See, as we get older, the amount of collagen and elastin in our hearts and blood vessels increase and decrease respectively. As a result, the blood vessels, heart valves, and myocardial tissue become stiff and thick, thus reducing the contractility of the heart and causing stenosis of the valves and vessels. Some of these are represented in these two pictures on the slide, and the end product of this is a slowed cardiovascular response to stress of any kind and reduced cardiac output, especially in times of increased stress. Lipid accumulation is another factor that contributes to stenosis of the vessels and valves, and when we hear murmurs, this is basically turbulent blood flow occurring when the valves should be open due to valvular stenosis. Electrical changes that occur with age include decrease in the number of pacemaker cells and conduction cells, and these changes contribute to the development of dysrhythmias in older adults. So a lot of members of the older adult population tend to have abnormal sinus rhythms, or if you look at the ECG readings, it tends to not be a regular sinus rhythm. This is typically because of, the reduced number of pacemaker cells and conduction cells. Apparently, at the age of 75, an individual may only have 10% of the normal amount of pacemaker cells that they are supposed to have. So that's just something for you to think about. Now, as a result of these changes, some assessment findings may differ depending on if the patient is elderly or not. For example, when assessing an older adult, you may find that chest landmarks are altered and heart sounds are distant, and this is as a result of the forward rounding of the back, which is also known as kyphosis. Older adults typically also have a decreased cardiac reserve due to hypertrophy of the myocardium and diminished pedal pulses, which is due to arterial stiffening. It may also be difficult to isolate the apical pulse due to a downward displacement of the heart, and you might hear a systolic murmur without any indication of cardiovascular disease, and this can be attributed to valvular stenosis. Now we've answered question 1 and 2, we can move on to our third question. And to answer our third question, I have identified 3 cardiovascular diseases that are common in the geriatric population, and we will be discussing the age-related pathophysiologic processes of each of these diseases that I've outlined here. And here's just another thing for you to kind of think about as we're going through. Age is considered the greatest risk factor for cardiovascular diseases. So as we get older, we're at a higher risk for developing cardiovascular diseases. Now let's talk about coronary heart disease. It can also be referred to as coronary artery disease or just heart disease. And simply put, it is any narrowing or obstruction of the coronary artery, which interferes with the cardiac perfusion to the heart. This narrowing can typically develop from a number of reasons, 2 of which I have identified: coronary artery spasms and atherosclerosis. Atherosclerosis is basically the hardening of the arteries, and it's caused by cholesterol deposits on the arterial walls. Now, coronary heart disease reduces the blood flow through the coronary vessels, thus limiting the amount of oxygen reaching the heart muscles, and it can over time result in a myocardial infarction, which is basically a stroke, or heart failure. Now let's talk about hypertension, which is actually the most common chronic cardiovascular disease in the geriatric population, and it is characterized by a persistent systolic blood pressure reading of 150 millimeters of mercury or more and a diastolic blood pressure reading of 90 millimeters of mercury or more. For adults who are 65 years and older, these readings have to be taken in the healthcare provider's office for hypertension to be diagnosed, and if there is not an identified cause, it is diagnosed as primary hypertension. Otherwise, it is diagnosed as secondary hypertension. Older adults most often have what we call isolated systolic hypertension, which is basically a progressive increase in systolic blood pressure with a decrease or no change in diastolic blood pressure. Now, this is typically caused by the thickening and reduced elasticity in arterial and venous blood vessels. Some risk factors for hypertension include, but are not limited to, age, stress, obesity. It is genetic, and our patients who have diabetes mellitus are also at a very great risk for developing hypertension. Hypertension itself is a risk factor for other cardiac diseases such as heart failure. And this brings me to our next slide, which talks about heart failure. So, what is heart failure? It is a disease of the heart, yes, and it is typically characterized by damage, malfunction in heart muscles, which results in inadequate supply to meet the body's needs. Now, this damage to the heart muscle can be caused by a number of things, some of which include long-term hypertension, fever, and hypoxia. And what basically happens in heart failure is that the tissues are so damaged that the heart is not able to pump as well, and so it's not able to meet our body's need for blood supply. And basically, all that being said simply is just the heart is unable to meet its workload. Now, if the underlying cause is not well controlled, the damage becomes worse and can actually result in what is known as congestive heart failure. And important point to note, there is no cure for heart failure. Now, an older adult who is experiencing a worsening of their heart failure, which sometimes you might hear them say as an exacerbation of heart failure, they may present atypically as confused and delirious with complaints of things like insomnia, nocturia, dizziness, and just things like that. And, in the general population, this is not how, people with heart failure would present. And so it's really important that our gerontological nurses are particularly alert for these presentations, especially in their patients who have heart failure. Now, to conclude this presentation, I am going to be talking about important education points that geriatric patients and their caregivers need to be aware of. The first is home measurement of blood pressure. This is very, very important, especially for those who have one or more heart conditions. Patients not only need to know to do this, but also the proper technique, what the readings mean, and what actions they need to take depending on what readings they get. Because if a patient doesn't know how to properly take their blood pressure, they're not going to get good readings. And then if they also don't know what the readings mean or what they should do depending on the readings they get, they're not going to be able to get help if they need help, say if they have a really high blood pressure, or say if their blood pressure is low and they don't need to take their blood pressure medication. So these are just important points that they need to know about. Patients and their caregivers should also be educated on the importance of exercising and eating foods that promote good health. They need to know what kind of exercises are helpful depending on their condition and what kinds of food they need to be eating, and also the kinds of food they need to be avoiding. Because we can tell patients, you need to eat these certain foods, and they know that, but they also don't know what to avoid. And if they don't know what to avoid, they can be eating what they should be avoiding without knowing that it's actually causing harm to them. Alcohol and tobacco are big risk factors for a lot of cardiovascular diseases, and patients should be educated on how to control their use, or if they need to, cease their use, depending on their condition. Now, another risk factor for cardiovascular diseases is stress. It's a really big one, especially for hypertension, and patients need to know this. They also need to know how to identify the things that cause them to stress and how they can avoid these things or control them. This is something that's very important, because if they're able to identify the things that stress them and they're able to learn how to control them, this can help them, in the long run, especially for our patients who have hypertension. So these are just some important points. There are definitely a lot more points that patients need to be aware of, but these are just some of the important ones that I listed out here. Thank you all very much for watching, and I hope this presentation was very informative. And on this next slide is a list of the sources that I used to create this presentation, and all of my pictures are from Google.